DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. Today we're going to have a show to talk about branding calves and preparing them for summer turnout. Thanks for joining us. Stay tuned and we'll be right back.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson and we're out and about today and we're shooting on location, which is always the best. But I'm a veterinarian and I work with Production Animal Consultation, and Heather and Kelly and I own Farming Unlimited, which we're able to bring these shows to you, and we're very thankful for all of you that watch the shows and continue to send the messages in. We love getting feedback on things that you would like to hear about. And one of them we've had is, hey, let's talk about branding calves. And branding calves is when we used to brand them before summer turnout so that we have those calves identified. But really this is about the first time that we're going to work these calves. And so the general age of calves at branding is 3 to 4 months of age. So they were born, we got colostrum, that gave us the passive immunity, right? From that cow to the calf. Well, as these calves age at that 3 to 4 to 5 months of age, the passive immunity is starting to wear off or wind down, indicating it's a good time to vaccinate these calves so that we get some active immunity against diseases such as IBR, BVD, and blackleg or Clostridium. So these calves have been moved from the calving pastures. We're going to bring them through. We're going to work these calves, and then they're going to go to summer turnout. The one thing you want to make sure you do at branding on these young babies is you want to make sure that we use low stress cattle handling techniques. It's vital. This is the first time that these calves have really been worked. So it's going to be a first impression of you on them and how that they can expect you to either be a caregiver or if they view you as someone who's not so nice and a predator. So the first thing I like to recommend is these brandings turn into sometimes a social event, which is great. We want to work with our neighbors. We want to work with people within our community. We want our brothers and sisters and aunts and uncles and cousins, everybody to come home and celebrate agriculture and celebrate our ranch. But when we're going to do these, it's vital to sit down and talk to them about how you have to live with these animals the rest of the 364 other days of the year. So while we want to have fun and we want to celebrate agriculture, we want to make sure that we're handling these calves and these cows in a manner that they understand and trust us. So one of the first things you need to understand is we want to separate these calves and the cows. We don't want to have calves getting stepped on. We don't want to have calves getting crushed. We're going to separate them and we're going to work the calves through first. So after we work the calves through and they're out in the pasture first, they tend to calm down a little bit quicker and they're getting along great. Well, mom wants to get back to the calf, so she's going to come through the facility a little bit quicker. And so there is some strategy in which we're doing this. And so as we bring these calves through the alley, we're being really, really gentle. We're using low stress cattle handling. We're applying pressure and releasing pressure. We're going to bring them through the single file. These little guys sometimes through the single file don't really understand what you want them to do. So while we're giving them some of those cues of low stress cattle handling, sometimes we got to get behind them, give them a little bit of boost, get them to a point where we can get them to that calf table, or we can get them to the place where we're going to cast them. And once we do that, we want to make sure that when we release them, we're giving them some positive reinforcement as we're kicking them out into that pasture. But again, low stress cattle handling at the time of branding, working with your neighbors, is vital to the success for the lifetime of that calf. We'll be right back after these messages. Hey there folks, welcome to Cattle Intel by Neogen. Today we're talking about biosecurity, and one of the components of biosecurity is to have a good vaccination program. You should work with your local veterinarian to develop a vaccination program, not only for core diseases that cattle would transmit across the country, but also work with your veterinarian to understand endemic diseases that we can vaccinate for within herds within your region. Understanding and having vaccinations on board well in advance of animals being commingled is a vital source and a vital practice for biosecurity, making sure that diseases that if they are exposed to that disease, they're vaccinated, they don't carry the disease, they don't contract the disease or the clinical signs of that disease. Thanks for joining us on Cattle Intel, sponsored by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cuperia, Nematodyrus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm a veterinarian in Kansas, also emeritus faculty at Iowa State University, which allows me to work with the industry on a day-to-day basis as a veterinarian in practice, which check us out, Production Animal Consultation, bring you the show through Farming Unlimited, and then work with students from Iowa State, Kansas State, and beyond. And today we're talking about branding, and when we're bringing the calves through, we talked about low stress cattle handling. Well, when we get them to the area, what are some of the things we're going to do? And vaccination is one of the key reasons why we work these calves. And so these calves have not been vaccinated. If they had, they may have gotten a blackleg at the day after they were born, or they might have gotten an intranasal for IBR, but they have not received any bovine viral diarrhea antigens in their life, okay? And if they had colostrum, and sometimes the maternal antibody from the colostrum will have a negative impact or neutralize the vaccine. So as the maternal antibody is waning, it's a great time. It's just kind of like when we vaccinate puppies, all right? That maternal antibody from the female dog will wane anywhere from 6 weeks to 12 weeks. And that's why we have you come in at 6, 9, 12, 15 weeks to get your puppies vaccinated, because we don't know when it's dipping down. We just know that within this time period, and if we do it multiple times over a 3-week period, we're going to hit it to where the vaccine is not neutralized by the colostrum, and then the vaccine is actually able to stimulate an active immune response. So work with your local veterinarian to pick out your vaccine programs. They know the endemic diseases, not only on your place or around your place, but also in the auction markets and places where these calves may be transferred, where may be sold, or where you may be buying calves to come into your herd. So understanding that is vital. The other thing that's vital is using good, solid BQA principles. Make sure that when we have those calves, we give the injection in the injection site. Some of the blackleg injections, even at the time of branding, if done wrong and put in the muscle, can show up as trim losses 13 months or 14 months later when we slaughter those animals. So using the injection site triangle, using good technique for subcutaneous injection. You can use the dewlap to give the injection, but make sure you give it sub-Q. We want to make sure that we mix the vaccines up no more than an hour before we're going to have them used. We want to make sure that we keep the vaccine in a cooler, that we put them in a cooler, that they're away from UV light and they're away from becoming hot to where they would become inactivated. We don't want our modified live vaccines becoming modified dead vaccines. Another thing to do is to make sure label your syringes so you don't get the syringes mixed up and you know what vaccine is going into what syringe. And lastly, we want to talk about needle changes. We want to change needles about every 10 head. If you look at the electron microscopy of multiple injections with the same needle, you'd be amazed at how burred and how scarred that needle becomes by giving multiple injections. So for the decrease in pain, the increase in efficacy, change your needles. And lastly, we're going to use something to clean the needles. So having a sponge there. Don't use disinfectant with your modified live vaccine. You just want to use tap water in a sponge where we can just get the outside debris away from it. The other products that you can use a disinfectant to help keep the needle clean. But again, that disinfectant will wick up the syringe of your modified live and will neutralize that and make it ineffective. These are just some more tips. We're going to come back. We're going to talk about castration and branding. You're watching DocTalk. Thanks for joining us.
Plant the seeds of financial security today with United Patriot Coins Precious Metals Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Founded by farmers, for farmers, United Patriot Coin stands with you. Diversify your financial portfolio with precious metals, a smart investment for uncertain times. You've worked too hard not to protect your assets. United Patriot Coin, precious metals for a secure future.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm glad you joined us. I'm a veterinarian located in Kansas, practice in Kansas, Nebraska, and Iowa mainly. But I travel all across the United States working with beef producers and groups, working with feedlots, working with packing plants, working with retailers, working with producer groups, and helping them set up their meetings and much more. But anyway, today we're talking about branding. We talked about low-stress cattle handling and vaccination. Another one we need to talk about are what we do with bull calves. And this time in a commercial herd, castrating at the time of branding, if you didn't do it earlier, is a great time to do this practice. And what I tell people all the time is that the longer the testicles are attached to the calf, the more attached the calf is to the testicles. So making sure we castrate these calves at a young age is vital to decreasing stress associated with castration. When we see these calves come into the feedlot and we have to castrate them post-arrival, that added stress increases our pull rates by 50 to 100%, and it subsequently increases the death loss by 50%, which none of us want to have happen. So when we castrate these calves, work with your veterinarian. We go to CE all the time to learn the latest techniques and the latest technologies associated with surgery and with castration. And while it seems simple and it seems like something we've done forever, and you may have a great technique that works for you, we're not trying to interfere with that. But if you look at some of the technology, if you're going to use knife cut, or if you're going to use a Newberry knife and you're going to remove those testicles on the calf, that's a great technique. Have your veterinarian show you how he or she would do that. Or have the veterinarian come work with you during this time. Another one is when we band these calves. And I think that we've talked about some of the pain mitigation on the show, that there's new technology coming out for castrating with bands, that we have lidocaine impregnated bands, such as Litaband, that are out on the market that you can use to band calves and castrate those calves at the time in which we're branding. So bringing those calves in, casting them, having them in a position that decreases the stress of that calf, but also improves the safety of you and the people that are working on them, is vital. Another thing is, when we turn these calves out after castration, some of the consequences or negative effects of castration can be hemorrhage. You want to watch the calves, make sure that we don't have any of them that have any subsequent bleeding. On the banding, we want to make sure we're looking at those calves, we're watching that's progressing, and that we don't get some that have a cord or something that's different. Watch for swelling of that scrotum, okay? Lastly, depending on the time of the year, and we've seen flies earlier this year than most, fly control is really, really essential for protecting those wounds on those calves when we knife cut. So using some sort of spray or something that's going to help protect those calves when we castrate from flies is going to be important. When we come back from this, we're going to talk about steroid implants in calves at the time of branding. You're watching DocTalk, and we're glad you joined us.
From sunrise feeding to midnight calving, it's planning and prepping every last detail so your family can enjoy the finer things in life. It's careful feeding, impeccable breeding, and herd health protocols to keep your slice of the industry forging ahead. More than just a website or print catalog, we're a dedicated partner with everything you need right when you need it. valleyvet.com.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so Alertis Test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, And I work with Production Animal Consultation and Farming Unlimited, two businesses that I'm extremely excited to be a part of. We're growing in many different directions, and so when you see us at Farming Unlimited at different events associated with the beef industry, come up and say hi, because we're kind of the ones that are behind DocTalk and being able to provide this show, and we're thankful that you watch it. So one of the questions I get a lot about at the time of branding is, should I use a steroid implant? And then the first question that I'll answer is, if they're bull calves that are intended ever for being used for breeding purposes, and you're going to leave them intact, you should never put a steroid implant in the ear of something that's going to be a male calf that's going to be used as a bull later. That will decrease testicular development. If it's a steer calf and you are not marketing that calf in a specialty market, such as NFTC or something that does not allow steroid implants to be utilized, then absolutely you should implant that calf. You will gain 15 to 30 pounds from using that implant from the time of branding to the time of weaning. And when we're looking at $2.50 a pound, you know, that's a subsequent amount of money that you're going to increase per head by using that steroid implant. Now use one that's labeled for calves on the cow, because now we have new regulations around utilizing steroid implants. Work with your veterinarian and have them tell you. The next question that pops up is, what should we use on heifers, or should we implant heifers? And I break it down into three categories when we talk about implanting heifers at the time of branding. We have those that we know we're going to market as feeder heifers. We have those that we know we're going to keep as replacement heifers. And then we have the ones that we don't know which way they're going to go, replacement heifers or marketed as feeder heifers. If they're going to be marketed as feeder heifers, absolutely implant those heifers with a steroid implant at the time of banding, because you're going to increase 15 to 30 pounds at the time of weaning. If you know you're going to keep them as replacement heifers, there's really no need to use a steroid implant on them, because you don't care about the accelerated growth, because you're going to keep them, you're going to develop them, and it's really not going to change the time in which those heifers reach puberty, okay? Now, the group that's in between is the ones I don't know today if I'm going to keep them as replacement heifers or if I'm going to sell them as feeder heifers. And those we now recommend to go ahead and implant. And the reason why we do that is we can maintain and get that captured growth of 15 to 30 pounds at the time of weaning that we're going to be able to capture at the auction market or in that private treaty sale. And the last thing is that we know that when we give that calf implant that's labeled for calves suckling on the cow, we're not going to have a negative impact on reproduction of that heifer. Okay? So again, if I know I'm going to market, never put an implant in an animal that's intended to be used as a bull. Implant our steers unless they're in some special marketing organic program that we can't utilize them. Same on heifers. And then on heifers, if we know we're going to sell them as feeders, implant them at branding. If we know we're going to keep them as replacements, there's no need to do it. And the ones in between, implant those at branding, because we know it's not going to have a negative impact on reproduction, but we know that it's going to have the positive impact on performance when we sell it. Thanks for watching DocTalk today. Remember, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson here out in sunny Kansas. Thanks for joining us today, and I'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so Alertus test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.